Namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we talk about your health conditions. Physically, अगर आप नहीं जा पा रहे हो एक फिजिशियन के पास या एक्सपर्ट के पास, पर आपके मन में काफी सारे डाउट्स है, हम लाएंगे experts from Apollo hospitals to this live show where you can ask all your questions and queries which have been unanswered. So चलिए आज का शो हम शुरू करने से पहले हम आपको बता देते हैं कि हम कैसे इसमें आपको पार्टिसिपेट करवाने के लिए चांसेस मिलेंगे. यू आर वॉचिंग दिस ऑन अपोलो 24/7's सोशल मीडिया प्लेटफॉर्म्स लाइक इंस्टाग्राम, फेसबुक एंड यूट्यूब. बट इफ यू हैव अ क्वेश्चन टू आस्क, please hop on to YouTube channel of Apollo 24/7 where you can ask the questions and I shall take up these questions. And also on the show we have a health quiz coming up where you can win prizes from Apollo hospitals as well. And we do have discount vouchers to share which you can use on Apollo 24/7. Download the app which brings the entire facility of Apollo hospitals just to the power of your mobile phone. तो चलिए आज का टॉपिक शुरू करते हैं. Today we are going to talk about joint pains. A to Z about joint pains. Name the joint, name the ache, we shall bring you the solution. And today we have one of the country's best expert who is going to join us in the live session. Let's meet Dr. Vikram Paode, whose experience ranges more than 29 years, and he is a senior orthopaedic consultant surgeon from Apollo Hospital CBD Belapur, Navi, Mumbai. He is a joint replacement surgeon, orthoscopic surgeon who does hip, knee and shoulder orthoscopic surgeries, and he can be consulted for multiple issues which are orthopedic related, and he's a complete joint surgery and he's a revision surgeon as well. So let's welcome Dr. Vikram Paode. Namaskar sir, it's an honor having you on this Sunday morning for this show.
Namaste. Very pleased to be with this platform. Let's hope it's a nice interactive session benefiting all the patients.
Absolutely, sir. Thank you so much for joining us this Sunday morning. And our audience are wonderful. They're joining from entire country. They will ask questions on YouTube, and I'm going to place the questions before you today. So before I start taking questions from our audience, I'm seeing that audience are joining in good numbers today. While they join and ask their questions on YouTube, please let your questions coming in. Abhishek, Prabhat, all of you. Early owl, yes, I'm going to take all your questions. But in the meanwhile, Dr. Vikram, while we understand that joints are very important for our mobility, pain and mobility, both of them are interrelated. If I don't have pain, I'll be mobile. But my mobility, if I'm not enough mobile, I might cause pain. So how are these two interrelated, and how are joints helping our mobility?
See, joints are there to mobilize from one place to another. So let
Yes,
me
sir.
start with an example. This is can you see it on the screen?
Yes, sir.
This
Yes, sir.
joint. This needs pristine, absolutely like an enamel of my tooth. So you will not have
Ah.
any pain. Human body
Ji.
was supposed to last only 30 years. But because of the advent of civilization, people of my age, Miss Lakshmi, will live up to 90 years of age, and you will cross 100 because you are from next generation.
Huh.
Could I show this specimen now? Can you see?
Yes,
There
I
is
can
a
see red inflamed.
cartilage has been denuded. This is like tooth breaking down and the gum getting exposed. It
Right.
causes pain, and because of the fragility of the bones, they get fractured, cartilage is lost, muscles become weak, and vitality of the body goes down. But if you can maintain the joint by exercise, weight reduction, taking proper care, eating healthy balanced diet, we will go a long way. Only 1 in a million
Right.
can run marathon at the age of 80 years. But let's hope for the best. So yes, if you take care of yourself, you will last longer. That is the bottom line of the story.
Right, doctor. So understanding that exercise is important. While you say that we need to exercise, how much is good, age appropriate exercises, and we as we age, we understand that there is gradual degeneration which is normal for a human body. But age appropriate exercises के बारे में थोड़ा बात करते हैं.
Exercise is important firstly for twofold. First, it brings you a feeling and sense of well-being. just like endorphins being released after a very long distance running, that you have accomplished that goal. Secondly, exercise will keep up the muscle bulk. Suppose if you apply a plaster for my upper arm for 3 weeks,
Mm-hmm.
within
Hmm.
3 weeks, my muscle is going to be half the size of the other arm and my elbow joint is going to be stiff. So exercise will keep it growing. Then,
Okay.
as you rightly raise the point, how much? And it has to be age appropriate. Somebody who is 80, 90 years of age, I would
Hmm.
recommend at least 20 minutes of walk at least 3 times a day if possible,
Yes, sir.
because that will help in the cyclical loading of the bones, bone to regenerate and remodel, muscles to maintain their bulk. But equally, if you ask me, doctor, one of your under 17 Maharashtra football player team, how much exercise he should be doing? I would say less is more, or he can do as much as he could. So these are very different options I'll be offering to my two people at the two extremes of the age spectrum. Does
Correct,
that
sir.
make any
Correct.
sense? But at least for a very senior citizen, if possible, 20 minutes of walk 3 times a week. Look, Ms. Jansi was be thinking this is very little, but those people are coming on wheelchair, on walker, 80, 90 years, where mobility is bit restricted. It's a very big achievement for them. And equally, I get people who run marathon at the age of 80, Mumbai marathon.
Correct.
There was a
Correct.
separate group for senior citizens. So that is very
Correct.
nice to see such senior people running marathon, full marathon I'm talking about, not 5K or
Yes.
10K at this age. Yes.
Okay. Yeah. So while I'm talking about now that we understand that the advent of medical technologies have come to the newer replacement surgeries, अभी तो पूरे नए जैसे दांत आपको आपने शुरू किया है दांत के एग्जाम्पल से, तो मैं लेती हूँ जैसे नए डेंचर्स आते हैं अभी तो नया घुटना भी लग सकता है नया जॉइंट लग सकता है. So let's talk about the replacement surgeries and full, partial, whatever. What are the newer treatments, Dr. Vikram?
So you rightly said, but this is not the operation I would routinely recommend, although I'm a revision surgeon. So when the first knee fails, the life of a knee is only 20, 25 years. Then the revision comes in. And successive revision, as you can imagine, are more arduous than the previous one. So let's come back to
Mm-hmm.
this picture again. That
Okay.
is that worn out knee. You can see those red cartilage being exposed. So as you rightly said, like a cap we put on, just like this, that blue bone is yours. And this
Ah,
white color structure is the cap on it. It's a very simple
okay.
procedure for me. We apply tourniquet, just like a blood pressure cuff over here, bend the knee,
थोड़ा ऊपर
just a
करेंगे
small,
सर कैमरा के. सर आप इस
okay.
तरफ अगर बता सकते हैं इस तरफ towards other side sir. Yes.
Is it
थोड़ा
better
ऊपर.
now?
Yes sir. Yes sir.
Yeah.
Perfect sir.
Okay. So there's the camera. So thus that's a cut made on the bone. And then we just put this one on the bottom side, like a tray.
Okay.
And that part is done.
All right.
Now I'm looking at the upper part.
Correct.
So that blue bone is yours. So you see, we have made 6 cuts. 1, 2, 3, 4, 5, 6. And we have just like Miss Jhansi was telling us, we just put a cap on the tooth. So can you see, I'm just like putting a cap over it.
Okay.
And that's our knee joint done. So knee
Done.
joint replacement is not like a liver transplant or a kidney transplant where you take off your knee and put some cadaveric knee. We just put caps on the kneecap, knee bones, and that is done under the influence of tourniquet. Nowadays we don't even need tourniquet. We do it robotic. So the cuts are very precise and the recovery is very rapid, and we can discharge the patient maybe in a day or two at the most. Of course, there is an option of half of the knee joint replacement also. As I mentioned
Partial.
in my previous partial, half of is partial. As I mentioned in my previous just few minutes before, I don't routinely recommend knee joint replacement as a first line of treatment, because many
अच्छा.
times GP is now so comfortable, little pain, and they will suggest, please go and get your knee joint change. I don't think that is a very good option. First, you try with the exercise and weight reduction. Secondly, if somebody is young, not everybody, like 20, 30 years, sometimes the knee becomes slightly bendy. You know what I mean? Bend means the knee is slightly bent like this.
Soft.
So we can straight it
हाँ,
out, the surgery I'm talking about, and put a plate on it. That is called as a correcting the alignment axis of the knee. Only when one compartment is gone, I will replace half of the knee joint. When all the
okay.
three compartments are gone, I will replace the full knee joint like that. This is
अच्छा.
nowadays done by robot, very quick, very effective, but not to be taken lightly, not to be routinely done. What are the indications? That is the next question Ms. Jhansi should be asking.
All right, sir. Yes, perfect. Because किसको चाहिए ये और कौन सा पेन को हम समझेंगे कि ये रिप्लेसमेंट चाहिए? क्या क्या इंडिकेशंस है?
See, if you go into, I was in UK for 20 years, I'm a British citizen. तो वहां पे क्लियरली गाइडलाइंस रहती है कि किसको नी ज्वाइंट करना है, किसको नहीं करना है. नथिंग हैज बीन लेफ्ट एट माय डिस्क्रिप्शन. देयर इज सम फ्लेक्सिबिलिटी ऑफ कोर्स. तो आप यदि पूछते हैं स्ट्रेट अवे व्हाट आर द इंडिकेशंस, सो देयर इज अ व्हाट इज कॉल्ड एज एन ऑक्सफोर्ड नी स्कोर. हिप्स के लिए हम लोग यूज करते हैं हैरिस हिप स्कोर. सो जैसे रात को आपकी नींद एकदम आप यू डिस्टर्ब, नाइट स्लीप इज डिस्टर्ब, जैसे सडनली यू वेक अप बिकॉज ऑफ द पेन इन द नी. That is not good.
Okay.
Because every night somebody comes and wakes me up at around 2 a.m., 3 a.m., and then I cannot sleep for 1.5 hours. Every day this is happening, that will affect me every day. Secondly, you can barely walk 15 minutes. You can't do your
Right.
activities of daily life. This will be the criteria for suggesting a joint replacement when everything else has failed.
Right, right.
That's,
So one is pain which is disturbing your sleep.
yeah. There is a chart which they give you the point scoring, but broadly speaking, if you want to understand, it's the activities of daily life getting affected, and you reach a particular score. That is where you will be offered a joint replacement. So Oxford knee score, everything is available on internet nowadays. People are learning quite a lot. Oxford knee score and Harris hip score, but there is some discrepancy. They are shopping means not shopping by car. You have to drive car yourself, go to mall, do your weekly shopping, come back again, and keep that in the cupboard. There is no help or no driver. So this is how the Oxford knee score is calculated. So we have to make provision for our Indian circumstances also.
Right, right, right. So ये बेस्ट है कि हम खुद ना करें बट एक्सपर्ट के पास जाएं. But as you said, understanding and having awareness of what is what also helps before you go and meet the expert. Right, sir. So understanding कि joint, काफी joints होते हैं हमारे बॉडी में, knee joint अकेला नहीं है, तो छोटे joints जो होते हैं हमारे wrist हो सकते हैं या finger joints हो सकते हैं या spinal joints हो सकते हैं, इनमें पेन के बारे में थोड़ा बताएं before I move on to the questions from the audience.
Yeah, that is a very important thing because as an orthopedic surgeon with joint replacement and arthroscopic surgeon, I was responsible for rheumatology clinics also. तो बाहर काफी जगह रूमेटोलॉजिस्ट और ऑर्थोपेडिक सर्जन साथ में मिलकर जॉइंट रिप्लेसमेंट क्लिनिक करते हैं.
अच्छा.
तो जैसे हाथ में आप रूमेटोलॉजी अपने यहाँ पर भी काफी कॉमन है. अपने आप एक मिसकंसेप्शन है, इट इज वेरी कॉमन इन टेम्परेट कंट्रीज, कोल्ड कंट्रीज में. अपने यहाँ पे उतना कॉमन नहीं है, पर अपने यहाँ पर भी रूमेटोलॉजी क्लिनिक फुल रहती है. तो वहां क्या हो जाता है, सबसे पहले जॉइंट ऑफ स्मॉल जॉइंट्स ऑफ द हैंड दे गेट डिफॉर्म्ड, ऐसे बेंड हो जाते हैं.
बेंड हो जाते हैं और कि कोई बेंड ही नहीं कर पाते हैं, स्टिफ हो जाते हैं.
हाँ, बहुत सीवियर डिफॉर्मिटी हो जाती है, सभी जॉइंट्स की होती है, बट हैंड एंड स्मॉल जॉइंट्स. और उसका क्लासिकल एग्जांपल रहता है अर्ली मॉर्निंग स्टिफनेस.
करेक्ट.
बाकी ऑर्थराइटिस वगैरह रहता है, मैकेनिकल प्रॉब्लम रहते हैं. जैसा जैसा दिन ढलते जाता है, एज द डे गोज बाय, योर पेन इंक्रीजेस. पर रूमेटॉइड में क्या रहता है, अर्ली मॉर्निंग पेन एंड स्टिफनेस द स्मॉल जॉइंट is the most important clinical finding that the patient tells you. My pain is worst first thing in the morning. My stiffness is worst in the small joint of the hands and the feet first thing in the morning. Of course, with some visibly deformities and very thickening of the joint capsule And then we do the blood test to diagnose rheumatoid arthritis. We do fusion, we do joint replacement. All very married step of treatment options are available. If the tendons are ruptured, we need to do reconstruction and repair that also.
Right.
That's all.
Right. Okay. So, understanding that any joint can be affected, including your spine joint also can be affected, but the treatment protocols differ for each one. It's better to consult your orthopedic surgeon or rheumatologist and then take a consultation. So, let me start. Yeah. Sorry, sir. You were saying something.
No, please. Thank you.
Yeah. So let me start with the questions from our audience today. A lot of them have been asking कि मैं knee pain के बारे में काफी सारे questions दिख रहे हैं sir. Let me start off with Abhishek. Abhishek says, hi. अरे यार question. Knee pain while carrying heavy things है. Early owl का question है. Abhishek Joshi had a patella surgery a month ago and मेरा let me start off with Abhishek's question sir. Patella surgery हुआ है इनका 1 month ago and knee is very stiff still. So how long will he take to recover?
Yeah. So patella, I assume उनका patella knee cap का fracture हुआ था, उसका उन्होंने सर्जरी किया है. And to be honest with you, हम पेशेंट को बोलते हैं 6 हफ्ते में you will be able to do activities of daily life. जैसे ड्राइविंग हो गया, चलना. But orthopedics कोई भी सर्जरी it takes a bit longer, almost 1 year to completely rehab yourself. तो आपको अभी फिजियोथेरेपी करना पड़ेगा क्योंकि आपने मुझे बताया नहीं कि एग्जैक्टली इशू क्या है, आपका नी कितना बेंड हो रहा है. पटेला सर्जरी में जनरली काफी सर्जन्स कभी बहुत ज्यादा कॉम्प्लेक्स फ्रैक्चर हो तो नी को इमोबिलाइज करते हैं, प्लास्टर में या स्प्रिंट में रखते हैं. हम लोग नहीं रखते हैं पर कभी कभी रखना पड़ता है, तो उससे स्टिफनेस आ जाता है. इफ यू रिमेंबर अवर टॉक, कोई भी ज्वाइंट को अपन 3 हफ्ते प्लास्टर में रख देंगे तो मसल हाफ हो जाएंगे, तो स्टिफनेस आ जाएगा, तो उसको ओवरकम करना पड़ेगा फिजियोथेरेपी से. आई होप योर ऑपरेशन हैज बीन डन वेरी वेल एंड यू विल हैव एन अनइवेंटफुल रिकवरी. नथिंग टू वरी अबाउट अभिषेक.
Yes, so मैं यहाँ पर एक पर्सनल एक्सपीरियंस भी शेयर करना चाहती हूँ और मुझे से एक क्वेश्चन भी करना चाहती हूँ सर. One of my aunt, my Masi, got a knee replacement surgery and she ignored her physiotherapy due to her pain. So due to her age, due to her resentment, fear, not aware. So काफी reasons की वजह से, and she has lost her balance. She has lost her confidence as well. So physiotherapy and exercise after surgeries, how important is it?
You can't emphasize enough the role of physiotherapist because they provide the emotional support. They get you moving because, as you rightly said, for a young person, you don't need any emotional motivation. They will do it themselves. But somebody who is very senior, who is very worried that I might fall again, she might have another fractures because of fall, sleeping on the wet floor. There are a lot of fear senior citizens are having in their mind, super senior citizens. So for them, and exercise, it has to be done in a very structured, supervised manner. You have to do physiotherapy, and eventually once you understand how to do it, you can do it yourself. But you have to do it. There is no turning back.
Rightly said, never leave physiotherapy around, and जितना हम emphasize करें उतना better है. Yeah.
Yes, very much.
So yeah, next question that I want to ask is about the knee pain. A lot of people are asking about Prabhat Pathak hai, both the joints are paining, knee joints are paining, and ये early owl है कि knee pain है while carrying heavy things. So क्यों होता है ये पूरे young लोग हैं, under 40s है.
Yeah. So human body, what is young? That is another criteria we would like to discuss. In orthopedics, we are young up to the age of 40. Cardiology, mostly up to 55. And neurology up to 60-65, because after that brain shows degenerative changes. We are the first branch to consider arbitrary. I have to say it is arbitrary. Huh? So what you are trying to tell me, Mr. Patil, is carrying heavy weights. You are under 40, so you are young by our criteria. This means you are having post-exertional pain. So this is nothing to worry about. I think you need to lose your weight, balance healthy diet, exercise. Sometimes I see people going to gym. Nowadays, it's a very good thing. I don't know how it is in other parts, but in Mumbai, everybody who I see comes with a physiotherapist, a dietitian, and a personal trainer. There is a full entourage. Most of the patients, they come with these two, three people together. So sometimes excessive squatting, putting on too much weight, getting all this personal trainer is very good, but you can push yourself body every year only to certain extent. So sometimes you must have respite, early wear and tear changes, can't do much apart from physiotherapy, mild analgesics. I'm not a great proponent of injecting steroids into the knee joint, or for that matter, platelet rich plasma, or stem cell, or lubricating oil. They are very good options, but they are temporary respites. It can't be recommended as a final definitive treatment. So, what Mr. Patil you are having is early post exertional pain. So, you must do exercise, lose weight, and don't have any criteria about your body mass index and others. And occasionally paracetamol, ice packs, and what did you say? Lifting heavy weights and
Yeah,
climbing up the stairs.
lifting weights while yes, while lifting weights and not climbing upstairs तो दिया नहीं है, but that's also a lot of people do ask. Body weight भी
Lifting
होता
is
है.
okay in the gym. In the gym, I assume it is. It's a
So sorry, sir, I
weightlifting in
couldn't
the
hear you.
gym. Weightlifting in gym
Yes,
workout,
not weightlifting in gym, sir. Carrying weights, regular weights.
carrying regular weights. So maybe some grocery or something he's talking about. So
Yes,
I think
yes.
you don't need to worry about. Keep on join a see a regular physiotherapist. There are very nice things also available on YouTube, but you should not go and randomly pick up anything. You have to go in a stepwise, successive manner. Apply ice packs. Volney gel is very good. I will just take paracetamol if it is really affecting him. And I think that is
Ji.
the way forward. So don't worry,
Yes,
Mr.
sir.
Patel, you'll be
Wonderful, sir. So while we say that our pain can be managed with ice packs and small exercises, यहाँ पर अगर early stages में पकड़ा जाता है, कोई टेस्ट है क्या कि कौन सा region से आ रहा है pain and कौन से वजह से हो रहा है? Any test that you would want to recommend?
I'm a very conservative surgeon. I work in the best of the places. But when I grew up, Jansi, there was no CT in MRI. My last year of MS, I got a CT. Looking at an image,
अच्छा.
but don't feel super blessed. And when I was doing my completing my registership, I got an MRI. So I am more accustomed to my clinical acumen. So test
Right.
X-ray is very good. Just now, some gentleman has shown us a Lawrence classification of wear and tear. How much is the medial space is decreased? MRI can pinpoint cartilage very well. I would only recommend when I'm struggling with my clinical diagnosis. Suppose some young lad has injured his knee, twisted it, and the cartilage has been chipped off, and there is a lice punched out defect. In that case only, I would recommend an MRI. Then there is a cartilage mapping also, which can be done by MRI. So these are some very fancy tests available in Apollo Hospital. But generally, a basic simple X-ray in a knee joint in a weight-bearing position gives me enough information. If you take an MRI for every small thing, it opens a Pandora's box because MRI writes a very detailed report, and that is really we can do without, to be honest with you. They will say there is a small tear in the cartilage, grade 1 tear. It is like crack on my lip. Many people come to me, doctor, I have cartilage injury and I have done an MRI. So I said, sir, this is only grade 1 cartilage injury. It is clinically not significant. If like a crack on my lip, if I insist, you might say, Jansi, put on some Vaseline or some lotion on it. But if somebody slashes my lip into two and it is bleeding, then it's a different story. That's a severe injury. You'll stitch it up. Not necessarily you're worried about cosmesis, but you don't want that scar to contract or some food coming out. So just a small crack, that is why I'm a bit worried about MRIs. And they are very good for
Huge
diagnosing cardiac.
respect to you, sir.
Yeah.
Huge respect
So
to you because
fine.
we don't find your gene, your species. You're one of the last of the kinds. Where huge respect to your practice, and we have to give it to your skills of observation, clinical diagnosis, which is very important. And people, let's all give it to their, they've been trained for a very long time, and these are the people who are certified, qualified, experienced to handle our bodies. So once again, sir, with huge respect, I will move on to the next question, sir. I hope we've answered enough there. So not many tests that you say. It's about clinical diagnosis, unless asking.
X-rays is good enough.
Yes, Dr. B.K. Pandey is cycling good for joints? That is one question. And Mr. Krishnan Subbaraman ji ka question bhi hai. He's 71-year-old. He used to run 2 kilometers 3 months back also. I have lobulated septated Baker cyst seen with partial rupture. Free fluid is noted in adjacent soft tissues with fat STABIG. Can you please advise what should he do?
Yeah, I got it. Mr. Siddharaman, 70-year-old male, runs 2 kilometers.
Yes.
He has got a ruptured Baker cyst. So,
Right.
first of all, let me tell Mr. Siddharaman, he is doing very well to run 2 kilometers at the age of 70 years. Just now we
71.
discussed
Wonderful, Mr. Krishnan Subbaraman. Wonderful.
So whenever there is a fluid inside, it will find its way because whenever you run, he must be having a wee bit of pain. So the fluid comes out at the back of the knee, over here.
Sir, this side, sir. Yeah.
Is it coming now?
थोड़ा ऊपर से हाँ sir. Perfect.
Okay. So where my index finger is, this is the back of the knee. So this is the place where the fluid comes out, and where my index finger is, it will form a cyst. We are touching the front of the knee. So
Okay.
this cyst sometimes ruptures. It's like a balloon, and it causes severe pain because the fluid is just like acidic fluid. But eventually it settles down. So now you have come with an MRI of a ruptured cyst. So it will be painful, tender at the back of the knee joint. He can just take paracetamol, ice packs. There must be some wear and tear in the knee joint. He can take an X-ray, and I am sure the MRI, does it show any arthritis in the joint?
Krishnan ji, if you can please text. Yeah, can you please type if you have MRI का क्या बोल रहा है? What are the any other questions that you would want Dr. Vikram from Mr. Krishnan? Any other information?
Ruptured Baker cyst can't do much about it. It is very painful, but the pain settles down. So he doesn't need to worry about pain on the back of the calf and back of the knee. That will be my advice. If the arthritis is not much, he can just take painkiller and continue activities of daily life. Okay, let's see what he tells us about arthritis. Mr. Pandey, you asked something about pain. What was that?
Cycling. I will come back to Mr. Krishnan Subbaraman ji says yes for arthritis.
Arthritis, initial arthritis can be managed by analgesics, exercise, and later on, when the activities of daily life get affected, like we were discussing before, he needs to consider the joint replacement. But he is running 2 kilometers, so he can still continue with physiotherapy and occasional painkillers. Yeah, like paracetamol. That's all.
Right. So otherwise, there's nothing much that we can do about it. Wonderful. So now, Mr. Pandey ji का question जो है, वो है 64-year-old है. Cycling अच्छा है या नहीं है? That was his first question. And 64-year-old cycling 8 to 10 kilometers every day. Please advise for my future. I have no joint pain at present.
This is another lucky gentleman we are seeing today at 64 years of age. He is doing cycling and he plans to do 8 to 10 kilometers. We are lucky today. So what the question is, he should be asking what can I do and what you will not suggest me to do. So what I will advise is do cycling, jogging and swimming. What he should avoid, impact loading exercises like where you jump and land on the knees. For ladies, it could be a step up or Zumba class. For gentlemen, it could be basketball or volleyball, where you jump very high and land with full force on your foot. And eventually the knee joint gets impact of that. So this impact loading exercises you must avoid. Cycling, running, jogging, swimming, as long as you can do it. And you are talking about 8 to 10 kilometers. It's really remarkable. Keep it up.
Wonderful, sir. Wonderful. Please continue. And you have actually given me motivation of getting back onto my bicycle, sir. Pandeyji, wonderful. Thank you. And sir, let's talk about ankylosing spondylosis, sir. Ashok Gupta has ankylosing spondylitis, different parts of the body, acute pain होते हैं. How is it different from the regular spondylosis, and इनको क्या करना चाहिए?
First of all, I'm extremely sorry to hear ankylosing spondylitis. It's an autoimmune type of disease. We do HLA B27 type of thing, but it can be positive in many patients who don't have symptoms of ankylosing spondylitis. Generally, it affects the hip, sacroiliac joint, and the spine.
Correct.
And the spine becomes like a bamboo. Sometimes the hip also gets ankylosed, means the joint fused together. We have just now discussed joints are essential for mobilization. So, which joint which joint this particular person is getting affected? Did they mention about spine or hip or sacroiliac joint? Did they mention
हाँ,
anything?
let's see sir. अभी तो मुझे दिया नहीं गया है, but we can ask Ashu Gupta ji, can you please text which joints are affected mostly? Yeah. So, do we have a specific region which is affected in ankylosing spondylitis, sir?
स्पाइन हो जाता है पूरा, और उसके पहले हिप जॉइंट अफेक्ट, सभी जॉइंट्स होते हैं, पर मोस्टली देखा गया है कि इनिशियली पेशेंट इज वेरी यंग, मोस्ट ऑफ द टाइम दे आर इन अर्लीज 20s or 30s, and they come with the hip pain and hip fused together. They cannot move the hip becomes fixed as if somebody has poured cement into the hip, and the spine becomes like a bamboo, so they can't bend. Sometimes that inspiration, see, even if I'm so old, when I breathe in, my chest expiration is 2 centimeters. उनका वो थोड़ा स्ट्रिक्ट हो जाता है, तो जनरली रहता है एनाल्जेसिक्स, फिजियोथेरेपी, और बाद में जॉइंट रिप्लेसमेंट और स्पाइन की ऑस्टियोटॉमी. कभी कभी बहुत लेट भी हो जाता है, कभी कभी बहुत जल्दी भी करना पड़ता है, डिपेंडिंग ऑन द सिविरिटी ऑफ द कंडीशन और कौन सा जॉइंट अफेक्टेड हुआ है. आई होप दैट हेल्प्स. उससे कोई रिमाइंडर आता है?
हाँ, उनका तो वापस मुझे क्वेश्चन आया नहीं है सर, बट नो अदर डिटेल्स एडेड, बट आई होप यू हैव गॉट योर आंसर, एंड वी आर एक्सट्रीमली सॉरी दैट यू हैव टू टेक केयर ऑफ योरसेल्फ अ लिटिल मोर carefully, and wishing you good luck. So कृष्ण सुब्रमण्यम जी ने वापस टेक्स्ट किया है कि उनको डिजेनरेटिव ऑस्टियोआर्थराइटिस दिखाया है एक्सरे ने, नी जॉइंट एंड लेफ्ट नी एपी एंड लैटरल व्यूज में डिजेनरेटिव ऑस्टियोआर्थराइटिस है उनको, बट कैन ही डू ट्रैम्पोलिन जंपिंग, स्विमिंग एंड रनिंग?
See, that is another good question. He has said after the age of 40, every joint will show wear and tear. Like I am now 60. So if you take X-ray for my cervical spine, for my knee, it is an age-appropriate degenerative change. Just like men, most of the men, and male species I'm talking about, will have thinning of the hair or graying of the hair by the age of 40. This is entirely normal. You don't call it pathological. So आपको जो भी सर दिख रहा है वो अच्छा है. आपका वेट, आप ट्रैम्पोलिन पे जंप करना चाहते हो, तो एज्यूम आपका वेट बहुत कम है एंड यू आर वेरी फिट एंड हेल्थी. पर जैसा मैंने पहले बोला था, इम्पैक्ट लोडिंग एक्सरसाइजेस नीड्स टू बी कर्टेल इफ पॉसिबल, एंड यू कैन डू साइकिलिंग, स्विमिंग, जॉगिंग. बास्केटबॉल, वॉलीबॉल, स्टेप अप, जुम्बा क्लास रिस्ट्रिक्ट कीजिए.
Right.
And don't worry about mild changes. As long as you can do activities of daily life, you are fine. That's from my side. Thank you.
Right. So Rabia ka almost similar question hai, but has a different experience. Dear doctor, I'm 56. I'm able to do cycling and walking for a long time, but suddenly I have been suffering from knee pain, and I'm able to fold the knee and even work out. But even though I'm working out on my knee, I have not yet recovered. So 12,000 steps per day, 1.5 hours cycling, 1 hour workout. But due to fear of further pain, I have stopped all of these. How do I? There's no problem in the X-ray. Do I need to get an MRI done?
As I said, I don't routinely recommend MRI as a first line of treatment. Something, if your doctor is worried about some specific tenderness on the bone or something else is suspecting, then of course he will recommend an MRI scan for you. Listen to your body. You cannot always run full marathon at every month for the rest of your life.
Yeah.
So you have stopped everything now, but I would recommend you start walking again, then jogging away, and then slowly build up. Problem starts when people think every day they have to run for 1 hour. Then they run for 40 minutes, sit for 20 minutes, and again run for 40 minutes. That sometimes causes strain on the body. So go slow, give some rest day, make a proper timetable, and you'll be surely going back to your normal thing. Or maybe you have to step down a bit low because body is telling you to stop whenever there is a post-exertional pain. And with endurance, you can build it up. What you have told me is a very hectic schedule. Looking, assuming you are a 56-year-old gentleman, cycling, walking is perfectly fine by me. Just go slow and you'll be fine and slowly build it up at the rate of 10%. That will be my
Yeah.
advice.
Yes, sir. So now I'm moving on to the smaller joints, sir. Shifaya, Indian. I am feeling pain in my finger joints regularly and increasing one to another. This is Shifaya's question. And Raju's question is, my mother's suffering from wrist pain. Please advise. And also Jagat Patel, 44-year-old male, hand finger joint pain when pressed horizontal. So let's address the joints which are in the hand, wrist and
Yeah.
hand finger joints.
Finger joints, generally, whenever there are young patients coming to us, there are different type of age groups where the finger pain could be there. Mostly the young IT guys are working 20 hours at a stretch on computers because they have to meet their deadlines. They're working in here and working, addressing some issues in the other part of the globe. So repetitive stress injuries will cause tendinitis. Mostly these are the guys sitting on the computers for 18, 20 hours. So take care of the body, take some rest, put on some splints. That should help you. Another thing I noticed is vitamin D deficiency.
What
Routinely,
important.
need calcium, vitamin D, and if you're a strict vegan, B12 testing and get it corrected. Because face constitutes only 5%. 80% of the body has to be exposed few hours a day to get proper vitamin D. Anybody who applies any type of lotion or cosmetic, ultraviolet penetration becomes almost zero. So you have to take care of vitamin D also. Too much of vitamin D will also cause toxicity and kidney stones. So get it checked at least once a year. Senior citizens, they will get arthritis at the back of the thumb. They will present
Okay.
difficulty like ladies taking out the bangles or trying to
Ah,
squeeze it.
right,
That
right.
case, analgesic surgery. Generally, we don't recommend, but there are surgical options for everything under the sun with us. For everything, we have got a surgery, it seems. But try avoiding surgery for fingers. Rheumatoid arthritis, they manifest very early. Bones are deformed. We do replace them. Although we tell them 8 to 10 years will need another surgery. But still, they are happy to go because they're absolutely in tears. So I
Yeah.
assume you guys, you rest to the part if you're overstretching, get your calcium and vitamin D, get it corrected. And if it is something very unusual, get an X-ray and blood test, and it should be fine.
Right. So while I was reading out your profile and I was understanding that you're an orthoscopic hip, knee, and shoulder surgeon. What is an orthoscopic surgery, sir? How is it different from the other surgeries?
See, before we used to meniscus is like a cushion in the knee or anterior cruciate ligament, footballer's ligament. We used to turn, we used to cut open the whole of the knee and used to open
Ah,
it up and then used to do the surgery. But we
right.
found that was very annoying, disabling for the patient and very lot of morbidity with that. So slowly, we started doing the keyhole surgery. And nowadays, most of the things we are doing it arthroscopically. That requires expertise. And we are glad that India has got one of the best arthroscopic surgeons, especially in the umbrella of Apollo. And many of the international level sports person, our own sports people have come and got the surgeries done. And they're back because of the rapid rehabilitation program. They're back to the playing ground in no time. So this has revolutionized the treatment. And not even before it was reserved only for very elite sports person. But nowadays nobody wants to live with disability. You might be 20 years old, but you play football. You don't want to stop playing football because you ruptured your ACL. So
Correct.
we repair for them also. And slowly we're expanding the scope and with some good results. That's about it.
वंडरफुल सो वाइल वी अंडरस्टैंड कि ये जो है इंजरी एक है जो जॉइंट को डैमेज कर सकता है to any other diseases, or age is one, regenerative or degenerative diseases में हो सकता है. Any other physiological reasons or any other diseases which can cause joint pains?
Yes, I mean let's talk about arthroscopy. मैंने तो आपको सिर्फ एक स्पोर्ट्स का एग्जांपल दिया. आपने क्या और क्या क्या डैमेज कर सकता है अपार्ट फ्रॉम स्पोर्ट्स इंजुरीज, पोस्ट ट्रॉमेटिक आर्थराइटिस एंड एज. पीवीएनएस कुछ ट्यूमर टाइप की कंडीशन से तो नी जॉइंट के अंदर या किसी भी जॉइंट के अंदर ग्रो हो जाती है. तो नाउडेज वी कैन टेक इट आउट आर्थ्रोस्कोपिकली. देन रूमेटॉइड आर्थराइटिस, उसके ऊपर जैसे वॉल के ऊपर अलगा या कोई सब ग्रो हो जाता है. That autoimmune disease causes very vitriolic things to grow and destroy the cartilage. तो साइनोवाइटिस हो जाता है, उसको हम शेव कर सकते हैं. Chondromatosis, there are multiple bone pieces lying floating in the knee joint like loose bodies that can be taken care of by knee or surgeries. And tumor, very mutilating surgeries, but we try to preserve it, and we have got very good results with knee preserving surgeries or any joint preserving surgeries, custom made prosthesis. There are many things where the joints can be affected. They can be metabolic, like gout. Gout means just serum uric acid very high, so it destroys the gout. We give the lifestyle advice. Surgery is seldom indicated, and metabolic disease, rheumatoid arthritis, autoimmune disease, post-traumatic arthritis, age-appropriate changes. Then we have discussed some tumors. These all can affect the joint. But fortunately, we are able to salvage tumors also, and people are able to live a very healthy, fulfilled life after that.
Wonderful, sir. Wonderful. Good to know that we have simpler and easy solutions rather than suffering from pain. So it's interesting. So Meera is a 60-year-old. Stiffness and pain in my right knee and the fingers of the right hand when I wake up. Becomes okay after some time. I do have nerve compression and cervical spondylosis also. So any advice?
Cervical spondylosis, as I rightly said, it will be seen on everybody after the age of 40 or even earlier on MRI by the age of 30. You will have a small disc at C6-7 level, sometimes pressing on the nerve roots. You will have discomfort like pins and needles going down. Most of the time, we don't operate on them. We give analgesics, muscle relaxant, nerve numbing drugs. Physiotherapy, as you rightly mentioned, that is so very important because that takes care of the degenerative spine and joints. That is the most important thing. So it becomes inevitable when there is a big disc pressing on the nerve, causing the loss of power or severe intractable pain. Then only as a last resort or red flag symptoms like loss of power, control of bowel bladder, then only we undertake surgery. Physiotherapy, then you mentioned nerve compression. Sometimes the nerve gets compressed at the wrist also, like you were mentioning before about the wrist pain. So at senior citizen, waking up in the night because of the pain, think about cervical spondylosis or carpal tunnel. Get a nerve conduction studies. If it doesn't show anything, just physio. If it shows mild carpal tunnel, you can manage with splint. Severe carpal tunnel means the nerve getting compressed over the wrist. A small cut and surgery will help you, but that needs to be assessed properly. That will be my advice.
किसको चाहिए, किसको नहीं चाहिए, इस expert को छोड़ देते हैं, and then you decide. Right. Okay. So next question is about climbing stairs. राजकुमार गुंडा जी पूछते हैं 50-year-old है कि suffering from knee pain only while climbing stairs, first floor, discomfort when I sit and stand from the chair, any tests and treatment. And also Mr. Martin Joseph is having intermittent knee pain and swelling, snapping sound hai, stretching toes in my right leg, climbing steps, but it's not there on the left side. So one side hai, stepping up and down, both of them are around 50 and 60.
Yeah. So both of these gentlemen, as I rightly said, are mentioning the knee pain only when climbing up and down the stair, and Mr. Martin only on the right side. Generally, what happens if you take an X-ray for both the knees, the picture is almost identical, but patient always complain of pain on one side. Yeah. So they say even if I put a small pebble on the left side of your shoe, you will automatically body put all the weight on the right side. So initially, first 6 months is right, then later 6 months it will be the left because of the altered walking. Best solution will be not to take stairs if you can avoid them. Many times people don't have lift in the building. Like in Mumbai, in old buildings, there are no lifts available. So people have to climb down the stairs, although they are in the smartest part of the town. So
Hmm.
try avoiding this stairs. Physiotherapy, because muscle bulk has to be maintained. Take physiotherapy, apply ice packs, mild analgesics like paracetamol is a really very good choice, and you will go a long way. And these are the age appropriate degenerative changes. Don't get too worried. X-ray is the only investigation I offer, AAP in the standing position, physiotherapy, mild analgesics. And people go a long way with this simple exercise. Trust me. And calcium vitamin D supplements.
तो सिंपल सर, आपने तो बोझ उठा दिया। कितना आराम से आपने एडवाइस दिया है कि सिंपल चीजें करो, कि आप स्ट्रेंथ गेन करो और आइस करो, रेस्ट करो, अंडरस्टैंड योर पेन। सच अ वंडरफुल एडवाइस डॉक्टर विक्रम, आई मस्ट अप्रिशिएट दिस सर। सिमिलर थिंग, रत्ना राव जी का सिस्टर है, इनर साइड्स ऑफ नीज में जब क्रॉस लेग पोजिशन में बैठते हैं उनको पेन होता है। शी इज 45-year-old. Even if she sits for half an hour, she has pain only in the inner side. Sir, position of the pain, वो कुछ बता रहा है क्या सर हमें? What does it indicate?
She's a very intelligent lady and she has very carefully observed where the pain is. So generally the
Correct.
arthritis starts from the inner side.
अच्छा.
Because if you remember, I was showing you this. See, this is the right knee looking from the front. Am I visible over here?
Yes sir. Yes
Can
sir.
you- So you can see a
Yes.
small bone. It is on the outer side because it is a right knee. You must be showing a mirror image. So generally, what
Correct. But under
happens?
your thumb, basically under your thumb.
Yes, you are right. So most of the weight goes through the inner side,
अच्छा.
where the other finger, this finger is there,
Right.
inner side.
That is the middle finger है, हाँ, inner side.
Yeah. So all the weight goes from the inner side. So that is the side to worn out first.
Oh.
That is the side which wears out first, age appropriate degenerative changes. And that's why many people do only half of the knee joint, mostly on the inner side, because that is the first side patients start complaining. Everything in the knee is perfect. Only the inner side of the knee wears out. That is why it is called as medial compartment osteoarthritis. From that is where the wear and tear starts. So for that, if it is just mild post-exertional physiotherapy, I've discussed injections are only a temporary respite. Then eventually people pain becomes unbearable. Then they should consider half of the knee joint. Many will do knee preserving surgery also the way if she likes. Question is we help patient make an informed decision. I might have some
Correct.
pain, but I don't want to go for anything, and that is my decision. You might have a little pain, but you are very keen to get off it and live a life, full life, as some of my patients tell me. I routinely tell my patients, why you go for half a knee joint? You are 15 years younger than me. But it is their life and we help them make an informed choice. So if the lady just
Yes.
that pain on the other side, she shouldn't get worried. Otherwise, we can do some knee preserving surgery. I was telling you, jacking up the knee because 60% weight goes from the inner side. So most of the wear is on the inner side. We can just straighten out the knee by a small cut and she'll be pain free for 10 years.
Yes.
That
Yes.
is one option. But she first needs to decide whether she just wants to continue because this is not an urgent surgery. Somebody breaks down the knee after falling down, will recommend an urgent surgery. This is the surgery done by us at your request to increase your quality of life. This is elective surgery. So these are the options available. You might find it strange, but in US, I have seen people going for knee preserving surgery left and right, and it is being suggested also over there.
अच्छा. अच्छा, कि ये अवेयरनेस भी बहुत इंपॉर्टेंट है सर। जैसे आपने बताया कि ये इलेक्टिव है, तो मुझे अवेयरनेस भी रहना चाहिए कि राइट चॉइस मुझे भी करना पड़ता है। दिस इज वेयर आई से दैट क्वेश्चंस लाइक दिस आर इम्पॉर्टेंट फॉर पीपल टू अंडरस्टैंड। वो क्वेश्चन इनका पर्सनल क्वेश्चन नहीं रहा। नाउ विद दैट वन क्वेश्चन इतना सारा अवेयरनेस आपने स्प्रेड कर दिया है। डॉक्टर, आई अप्रिशिएट यू वंस अगेन। मिस्टर कृष्ण सुब्रमण्यन इज ऑल्सो अप्रिशिएटिंग यू फॉर throwing so much light on the things that people do ignore. So appreciating you once again. Please accept our compliments. So
Thank you so much.
here's, yeah. So that was the answer there, Ratan Raji. Next question I want to move on again is ankylosing spondylitis because I've seen 2 or 3 questions about it. Yogi Tech इनका एज है, योगी का एज है 38, वेट है 105, एंक्लोसिस स्पॉन्डिलाइटिस है. मैं जिम में कार्डियो कर सकता हूँ क्या? अगर कर सकता हूँ तो कितना देर में कर सकता हूँ? ये इनका क्वेश्चन है. और किसी का सन है 17-year-old जिनको एंक्लोसिस, नागकुमारी का सन है 17 ईयर, एंक्लोसिंग स्पॉन्डिलाइटिस 2 महीने से है, started with hip pain but no medication right now. He's recovered, but with medication he recovered but he's still on medication. Prognosis क्या हो सकता है? Long run में इनको क्या करना चाहिए? What do they have to do?
So let's answer each question separately. First we'll go to Mr. Yogi. He's 38 years old. 56 क्या लिखा है आपने उनका? 56
Yes, 105 kilos.
Weight is 105.
105.
And do cardio. Make hay till sun shines. You can do the cardio. And sorry. And listen to your body.
So would you want to have a glass of water?
No, that's
You want to
okay.
have a sip? Yeah, please.
That's okay. So another thing is that make hay till sun shines. You can jog, and when the body is hurting you, you can stop. Because you are having an ankylosing spondylitis, many times, many people just do HLA-B27 test and they label you as ankylosing spondylitis, which in my opinion needs to be investigated further and it has to be a clinical diagnosis. So you can jog as much as you like, because if it is really ankylosing spondylitis, later on other joints will get affected. So there is no restriction from my side. If the pain is quite unbearable, you won't be able to jog. I hope that stage is miles away from you and you stay healthy and fit. And you are 38 years of age. So generally by this time, ankylosing spondylitis would have been a full-blown picture by now. So I'm giving you the benefit of doubt, Mr. Yogi. Okay? And let's hope for the best. Keep on doing gentle jogging and keep on pushing it as much as you can. Whenever there is severe pain, don't push yourself. Take rest, analgesics, and get some imaging done. That will be my final advice to you. Next, we'll go to the 17-year-old with 2 months.
Nagakumari.
We just give painkillers, muscle relaxant, antacids. So you will feel better in the early stages.
Okay.
Ankylosing spondylitis really has got no cure medicines available. We give some disease-modifying drugs, or some rheumatologist will try some drugs for you, but it will be an insidious course. So you cannot be feeling sorry for yourself every day. When the going gets tough, the tough gets going. You have to face it up bravely. You and your 17-year-old baby. Sorry, baby means your what is the name of the lady?
Nagakumari's son. Nagakumari.
Nagakumari's son. So let's hope he is well taken care of by a rheumatologist and orthopedic surgeon, and I wish him a speedy recovery.
Correct. Right. So he's on medication at this point.
She's already on medication, but she has not mentioned what medication she is taking.
No, sir. No idea. So they're asking, yes, please go ahead.
Yeah.
So I see that we are almost towards the close of our session. Dr. Saab has gone for a sip of water. He's having a coughing bout. So thank you so much. He's amazingly patient in answering these questions. So yes, sir. So no medications listed there, but yes, they have responded well for a few months.
Yeah, we need to know what medication that son is on.
Okay.
And medications mostly are for supportive care, painkiller, muscle relaxant, antacids, and sometimes disease modifying drug with the rheumatologist give. So she should continue that. Physiotherapy is very important, otherwise the joint will stiffen up. That will be the only last thing I would like to add.
All right, sir. Great explanation there, sir. Last two questions and quick answers I'll expect because it's already 11:54. अभी निराली शेरनी जी पूछ रही हैं कि ankle pain है. I cannot squat. I can, as I used to earlier. 51-year-old है. LCS है, diagnosed with early changes of osteoarthritis. How to manage pain and lost mobility? Any surgical options here, sir? Ankle है sir.
एंकल पेन में देखना पड़ता है कि जैसे लोग स्टेप अप या जुम्बा क्लास करते हैं, कोई टेंडन या लिगामेंट वगैरह पे इंजोर नहीं हुआ, तो एंकल पेन हो रहा है. व्हाट इज हर क्वेश्चन? लॉस ऑफ मोबिलिटी. एलसीएस क्या बोला
Loss
था
of
आपने?
mobility है sir. She's unable to squat. 51-year-old है. LCS है. Early stages of osteoarthritis है.
व्हाट इज एलसीएस?
I'm not sure sir. LCS कुछ है तो आप निराली जी, if you can. All right. So, Nagakumari's son is on SAS-DS and IMNIS in 25. जो ankylosing spondylitis 7-year-old.
और सास पे
SAS-DS, IMNIS in 25.
या तो इम्यूनोमॉड्यूलेटिंग ड्रग्स दे रहे हैं उनको. ये जो ड्रग्स रहते हैं रूमेटोलॉजिस्ट प्रेस्क्राइब करते हैं. लेट्स होप ही बिकम्स बेटर विद दैट. दे आर वेरी गुड कॉम्बिनेशन ऑफ ड्रग्स. फिजियोथेरेपी कराते रहिएगा. इवेंचुअली जब जॉइंट्स जितना अच्छा हो जाएगा, दैट्स रियली वी आर होपिंग फॉर. जब जॉइंट्स फ्यूज हो जाएंगे, बहुत ज्यादा आर्थराइटिस हो जाएंगे, तो उनको बोलिए जरा जल्दी से जॉइंट रिप्लेसमेंट करने के बारे में सोच लीजिएगा. शी शुडंट डिफर इट टू लॉन्ग.
Okay.
क्योंकि एंकल
So Nagakumari ji, you have to think about joint replacement surgery. Do consult Dr. Vikram Paode ji. We have shown his link on the chat box, which is pinned and left. Apollo 24/7 का link भी हमने दिया है. So one last question before I close this session, sir.
Don't panic. He will go a long way. नहीं तो उनको लगेगा अभी करना चाहिए क्या. उनको जरा बता दो नागकुमारी जी.
ठीक है sir. Thank you so much. You have a long way to go. Do not panic, but you can think of surgery. So one last question. What is your advice about robotic surgery? अभिषेक जोशी जी, आपका क्वेश्चन ऑलरेडी हमने ले लिया है. फर्स्ट ही आंसर दे दिया है. डोंट पैनिक. प्लीज गो बैक टू द रिकॉर्डिंग व्हिच विल लीव आफ्टर द लाइव. यस सर. सर, रोबोटिक सर्जरी के ऊपर आपका ओपिनियन?
Yeah, robotic surgery is one of the tools. Like the car can be any make, but it is a driver which matters, because I'm from old school thought. But yes, precision has been very good. The soft tissue handling has been good. So the recovery and rehabilitation has been very fast. And the cuts are very precise. So these are very much the points in favor of robotic surgery. What is against robotic surgery? It takes longer. It increases the cost. So you have to balance between the two. So I would say robotic is a better option.
Wonderful, sir. So with that, sir, I'll take questions. मैं audience से लेना बंद करूंगी क्योंकि it's already 11:58. I'll have to close the show. What are your top 3 tips for me to offer for our audience who have joint pain? What are the top tips that you can offer us, sir?
First of all, understand what is the problem. This could be an age-appropriate degenerative change. Maintain a healthy lifestyle, balanced diet, do regular exercises, take calcium vitamin D supplements very regularly. If you are very young and when there is a locking, clicking and blocking of the knee after sports injury, don't ignore it. Get an immediate MRI. That might show some ligament injury which might need to be addressed. Activities of daily life, only when they get affected, you have to think about something drastic. Till that time, mild analgesics and physiotherapy will help you.
If you're feeling, sir, if you're having a coughing bout, I think we can give you some more time. But
we've done it. There's a lag between you and now. I'm done with that. Yeah. Sorry about that. Yeah.
Yeah. But thank you so much, sir, because while we think about surgeons who are such qualified surgeons and with so much of experience, with 29-30 years of experience, and you are not pushing towards surgery, it means a lot. That means there is something more that we need to concentrate on our body and understand our body better. We appreciate your presence today here, sir, and value your time on Sunday. Thank you so much.
Thank you so much. I wish you all the best.
Thank you so much, sir. It was wonderful having Dr. Vikram Paode on the show. Namaskar, sir. And I continue with quick health quiz. You have to answer the questions on YouTube chat only. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your name to be the winner, you have to write back to us at marketing@apollo247.com before Wednesday of every week, and gift vouchers will be shared with you. You need to have Apollo 24/7 membership as well. चलिए आज के questions मैं screen पे डालती हूँ. The first question is fill in the blanks. It's very simple. Fill in the blanks. Joint discomfort is common and usually felt in your hands, feet, hips. K से शुरू होता है. There are fill in the blanks. और S से शुरू होता है. Fill in the blanks. These are two organs, or these are two joints. Where are they? Joint discomfort is usually felt in your hands, feet, hips. Please fill in the blanks. KN space blank E blank and S blank IN blank. Question number 2, true or false? Joint pain can have causes that aren't due to underlying causes. True or false? Joint pain can have causes that are not due to underlying disease. Yes or no में answer कीजिए. Third question, painful joints can interfere with your quality of life. Yes or no में answer कीजिए. Painful joints can interfere with your quality of life. These are the 3 questions. While you're answering these questions, let me give you gift coupons that you can use on Apollo 24/7 app. The first one that we give away is AskDoc150, AskDoc150. Use this on Apollo 24/7 app, and you can consult top doctors, get 150 rupees cash back on online doctor consultation. The next one that we give away is first 3 FIRST3. Use this code to order medicines direct from Apollo, and you get 2-hour delivery as well. And when you order direct from Apollo, you get 25% off when you use the code FIRST3. The next one that we give away is exclusively for our health viewers. We give you HH247. Use this code to get 199 off on online consultation with Apollo doctors and 20% off on medicine orders as well. And Apollo 24/7 now can be accessed on WhatsApp as well. Here's the number that you can save, 9355-247-247 to avail healthcare services. Just a text or a call away on WhatsApp as well. Next week, we are talking about how to take care of your liver. Liver, the largest organ, internal organ, which takes care of 500 plus metabolic activities, the most important for your detox, and the most killer diseases as well from the liver. How do we take care of our liver, and how to be away from the fatty liver or any other liver cirrhosis? Let's understand everything about liver health. 28th April, that is 11 a.m. next Sunday. Do join us. Do register prior so that we can take your questions on the registered users questions as well. So I do see that a lot of people are participating. हमारे regulars भी आ गए हैं. Let's see who the winners are. The winners are Komal, Yogi Tech, Health, Hope, Happiness. Wow, such a lovely name. Komal, Yogi Tech, Health, Hope, Happiness. You are the winners for this week. Please do write back to us at marketing@apollo247.com before Wednesday with all your contact details and your Apollo number as well, Apollo 24/7 number as well. Chaliye, take care of yourselves as well. See you next week. Until then, namaskar. Thank you for joining today.